The history of breastfeeding is often presented as a universal symbol of care and maternal devotion. Yet, in the slave societies of the Atlantic world, it operated within a system where black women's bodies were used to sustain white households under compulsion. Infants of enslaved mothers were, in documented cases, deprived of consistent maternal feeding, while their mothers were assigned to nurse the children of slaveholders. This arrangement positioned breast milk not simply as nourishment, but as a controlled resource within a labor system defined by ownership and hierarchy. I truly need your support to keep this going. Please subscribe to the channel today. Kindly activate the notification icon for more content. Wet nursing, the practice of one woman breastfeeding another's child, has existed across multiple societies for centuries. Its form, organization, and meaning have varied depending on social structure, economic conditions, and cultural norms. In the Atlantic world, particularly between the 16th and 19th centuries, the expansion of plantation slavery reshaped wet nursing into a system embedded within coerced labor. Before the emergence of racial slavery in the Atlantic world, wet nursing was widely practiced in Europe, parts of Africa, and the Middle East. It was often associated with class structures. Elite households commonly employed wet nurses, while poorer women provided the service in exchange for wages or material support. In early modern Europe, wet nursing became an organized occupation. In countries such as France and England, contracts regulated the duration of service, payment, and expected conduct. Infants were sometimes sent away from urban centers to be nursed in rural households. Records from parish registers and legal documents indicate that wet nurses were selected based on health, diet, and reproductive history. In West African societies, communal breastfeeding practices also existed, though they were structured within kinship systems rather than wage labor arrangements. Women within extended families or communities could nurse children other than their own, particularly in cases of maternal illness or death. The transatlantic slave trade, which developed between the 15th and 19th centuries, introduced new labor demands within plantation economies in the Americas. Enslaved women were assigned multiple roles, including agricultural labor, domestic service, and reproductive functions. Wet nursing became one of these assigned roles. Plantation records, personal correspondence, and slave narratives provide evidence that enslaved women were required to breastfeed the children of slaveholders. This practice was documented in British North America, the Caribbean, and Brazil. It was particularly common in urban households and among wealthier plantation owners. Historical records indicate that enslaved women who had recently given birth were often selected for this role. In some cases, they were removed from field labor and assigned to domestic service specifically for wet nursing. Advertisements from 18th and 19th century newspapers in cities such as Charleston, New Orleans, and Rio de Janeiro include notices offering enslaved women for hire as wet nurses. Documents from plantation management and household records indicate that enslaved women were expected to prioritize the feeding of slaveholders' children. This arrangement sometimes resulted in limited access to breast milk for their own infants. Slave narratives collected in the 19th century describe instances where infants of enslaved women were cared for by other members of the enslaved community, while their mothers performed wet nursing duties. In some cases, supplementary feeding methods, including animal milk or early weaning, were used for enslaved infants. Medical writings from the 18th and 19th centuries also reference these arrangements. Physicians and household manuals occasionally discuss the use of enslaved women as wet nurses, particularly in relation to infant care among European-descended populations in colonial settings. Wet nursing within slave societies was subject to supervision by slaveholders and household managers. Instructions regarding feeding schedules, hygiene, and conduct were sometimes recorded in plantation journals or domestic manuals. In certain cases, distinctions were made between infants based on racial classification. Some sources describe beliefs about differences in milk quality, though these claims varied and were not consistently applied. Despite such claims, the practice of using enslaved women as wet nurses remained widespread. In Brazil, municipal records and travelers' accounts from the 18th and 19th centuries describe the presence of enslaved wet nurses in urban centers. These women were often identifiable by their dress and by the infants they carried. Similar descriptions appear in accounts from the Caribbean and the southern United States. Wet nursing had economic value within slave systems. Enslaved women with the capacity to lactate could be hired out to other households. Newspaper advertisements and sale records provide evidence of this practice. In urban areas, particularly in cities such as Salvador, Havana, and New Orleans, enslaved wet nurses were part of a broader system of hired labor. Fees were paid to slaveholders rather than to the women themselves. Contracts or informal agreements specified the duration of service and conditions of care. The valuation of enslaved women in sale records sometimes reflected their reproductive status, including their ability to nurse infants. This indicates that lactation was considered an economically relevant attribute. Following the abolition of slavery in the 19th century, wet nursing did not immediately disappear. In many regions, formerly enslaved women continued to work in domestic service, including as wet nurses or infant caregivers. Census records, employment registers, and household accounts from the late 19th and early 20th centuries show that black women were employed in childcare roles in both the United States and parts of Latin America. These roles often included breastfeeding, particularly in households where alternatives such as formula feeding were not widely available. Payment for such work was typically low, and employment conditions were shaped by broader labor inequalities. However, the structure of the arrangement differed from slavery in that it involved wage labor rather than legal ownership. During the late 19th and early 20th centuries, developments in medical science and infant nutrition began to alter the practice of wet nursing. The introduction of pasteurized milk, infant formula, and bottle feeding reduced reliance on wet nurses in many urban settings. Medical literature from this period reflects changing attitudes. Some physicians advocated for maternal breastfeeding, while others supported artificial feeding methods. Discussions of wet nursing continued, particularly in relation to infant health and disease transmission. Hospitals and charitable institutions sometimes maintained wet nursing programs. Records from these institutions indicate that wet nurses were screened for health conditions and monitored during their service. Wet nursing has existed in various forms across global history. Within the Atlantic slave system, it became integrated into the structure of coerced labor. Enslaved black women were assigned to breastfeed the children of slaveholders, and this role was documented in plantation records, advertisements, and contemporary accounts. After emancipation, wet nursing continued as part of domestic labor systems in the Americas. Over time, medical and technological changes contributed to its decline. The historical record reflects the institutional, economic, and social dimensions of wet nursing across these periods. I humbly ask for your support. Please subscribe to the channel and help us keep producing meaningful content. Don't forget to turn on the notification bell for more.